all Georgians to do the right thing. Practice social distancing, wash your hands, and wear a mask. By following the guidance provided by our public health officials, you can protect yourself, your loved ones, your community, and your state. Your actions can help end the pandemic and begin our recovery. We're in this fight together, and I'm urging everyone to do their part. I hope everyone has a safe and happy July 4th. And now I'll turn it over to Dr. Toomey for a few remarks.
Thank you for being here today, because it's so important to get this message out to everyone in Georgia. Until we have a vaccine, until we have a cure for COVID-19, we have to work together to do all we can to ensure the virus doesn't continue to spread. We're concerned about the upticks, but we can work together to stop this. And wear a mask, social distance, and wash your hands, and do all those things that we talked about at the beginning of the outbreak. We have to continue to do that, not only to protect ourselves, our family, our community, but as the governor I think so brilliantly said, we have to do it to ensure that we can do all those activities that we want to do in the fall, like go to college football and go to our basketball games and do the things that we want to do in a crowd. We can't do that now. And we have to work together and be responsible to allow that to happen. It's going to take all of us working together. The other thing is, please answer the call. We have to, as we identify individuals with COVID-19, we will interview people and try to identify their contacts quickly so we can have them isolate at home if at all possible and stop the spread of the virus. We're trying to do that very, very quickly and efficiently and very confidentially, so you don't have to worry about this being publicized in any way. We haven't had as much support as we have hoped from all the communities, and we really need you to get this message out. Answer the call when we call it, and work with us to ensure we can stop the spread. Wearing a virus, that's what, unfortunately, wearing a mask so you don't wear the virus, social distancing, and working with your health departments throughout the state to get tested, to work with us on contact tracing. We can get ahead of this virus and look forward to those days ahead when we can do the things we want to do. Thank you so much.
Greg. Governor, a few minutes ago, a mask mandate took effect in Savannah. Are you open to local communities passing more restrictions?
Well, first of all, as you all know, the fiscal year for the state of Georgia starts today. So yesterday and the day before, we had a bunch of pieces of legislation that we had to sign, including the budget, the long-term care facilities protections, a lot of local bills. So I haven't had a lot of time to review what other local mayors are doing. I think, like I've said in the past, we all agree that we're working hard to protect the lives and the livelihoods of all Georgians. You know, I'm running the state, they're running the city. I understand that. I understand that we can disagree on how we go about solving a problem, but I think we all agree that especially right now, it's wise for people to wear a mask, especially when they're out in a public setting and they can't socially distance themselves. That's why we're sending hundreds and hundreds of thousands and what will be probably several million masks to local communities, to help our schools, to help our businesses, to help our citizens. I would encourage all mayors, local community leaders, business leaders, nonprofit leaders. I made this plea, if you will, and call to action yesterday on a call with hospital CEOs. Do whatever you can, what your people in your organization can do. I talked to Speaker Ralston about this yesterday to encourage the legislators to do the exact same thing. Encourage people to wear a mask. If they don't have one and you want one, call your local government, call your local emergency management agency. We are in the process, as we speak, of sending hundreds of thousands of masks to local communities, and we can get you one. Georgians have heeded the call to provide PPE in unprecedented ways. We've been to a lot of businesses to showcase that. There's large availability now for masks, and that, in my opinion, is how we need to tackle that problem.
So you don't plan any state action that blocks?
Well, I wouldn't be able to speak about any state action because I haven't had time to even really discuss the matter with our legal team. But regardless of, what legal action may or may not happen, we shouldn't get to that. I think that's one of the things that Dr. Toomey and I've talked about. We shouldn't need a mask mandate for people to do the right thing. I understand, where, where people are or have been. I wouldn't necessarily say that they're there right now, but I know 10 days ago they were. People had let their guard down. We were moving in a very positive direction. Summer hit. People were itching to get out after weeks and months of shutdown, not only in our state but across our country. And quite honestly, folks got lackadaisical a little bit, and we're all guilty of that. But now is the time to renew our commitment, like Dr. Toomey says. If you're ready for some football in the fall, as I've told my daughters, they keep asking me, Dad, do you think we're going to have college football? Surely we got to have the season. I said, well, if people, especially our young people, don't start wearing a mask when they're going out in public and our numbers keep rising, that's going to be a tall task. But if we all hunker down right now and dig in for the next 2 or 3 weeks and get this turned in the right direction like it was, and we could do the exact same thing with the number of cases that we're seeing in our fatality rate right now. I mean, it is on a solid downward trajectory. That is what we need for our case count.
You said with the hospital rate, is that also on a downward trend, or is that going up? Do you think it's because it's the young people getting it and not needing the hospitalization?
Well, I think on the hospitals, it's definitely been going up when you look at the overall count. But, and I think this is something that's good for our citizens to realize. We're not just looking at the overall statewide count. We're looking at the local community. I mean, Dr. Toomey and I have been focused on a lot of different areas of the state. John King and I were in Gwinnett County last Friday. We continue to work very hard there. Dr. Arona and her whole team at testing sites, contact tracing. Our insurance commissioner, John King, working in the Hispanic community to raise awareness, much like the issue that we had up in Hall County. We're focused in Troup County on a nursing home issue, a jail outbreak in a jail, and then we have other similar spots like that around the state that we're focused and targeted on. And it's the same for our hospitals. We have some hospitals that are having staffing issues right now, so the state is working with them to augment that. We have others that are not seeing an issue right now, so it really depends on, the system you're looking at, the community that system hospital may be in, but there's no doubt our hospitalizations have increased. Thankfully, they're not going up exponentially. It's worrisome, but not alarming at this point, and we don't want it to get alarming. I mean, Georgians sacrificed a lot to prepare us for this moment right now, where if we had another uptick, we could handle it. And we are certainly handling it in our hospitals. What we don't want to get into is having to stand up other facilities and go into emergency type situations, statewide. And I'm hopeful that if people will heed the guidance, socially distance, and wear a mask, especially for the next 2 or 3 weeks, we won't have that issue. Some good news from our hospitals, though. In every single CEO call I've had, and there's been many, including the group call that we did yesterday, the treatments are much different than we saw 6 or 8 weeks ago during the peak of our hospitalizations. Lower and lower uses of ventilators, different treatments that the physicians and the nurses and the hospital teams have learned not only here but around the country. The exits from the hospital seem to be speeding up a little bit, so the length of stay is not as long as it was, and the acuity of the virus for most, not all, has been less than it was. Still very vulnerable to our elderly and medically fragile population. Dr. Toomey and I have talked about this as well. We're seeing a new slight uptick in our younger people and children with COVID. Most of them are faring very, very well, which is why a lot of our medical profession groups think that we need to get kids back in school. But those that have comorbidity, pre-existing conditions like obesity and especially diabetes, this disease, this virus can hit them very hard.
This is a question for Dr. Toomey. Dr. Toomey, you said that people weren't participating in contact tracing as much as you would have hoped. What percentage of contacts are you effectively tracing? And does the continued suggestion that people participate, but you're still not seeing numbers you want, does that somehow say we need to kind of mandate for people to participate, or does they wear a mask?
Well, the truth is people are expected to do this as part of disease surveillance. This is an expectation. I mean, technically it is legally required. You don't want to use that kind of coercion to get people to work with the health department, whether it's COVID or whether it's measles. And this is something that we need to do to protect our community and those around us. I think people are just concerned about giving names, and we're still averaging about 3 contacts, in some cases 5 contacts per individual, and we hope we'll even do better as we move along.
Well, so how many of the contacts you get initially, how many are you effectively tracing to a point that you're happy? Can you give us a percentage?
No, we're actually tracking those data. I don't have them on my head at this point, and we can get that to you. And we are asking them to quarantine just as anybody else would who's been exposed to the virus, and then testing them. And so I'm anxious to see what the positivity rate will be. I suspect that will be much higher than your average person going into one of our testing sites.
I mean, can you even ballpark it? Is it a third? Is it half?
No, I just can't do that off the top of my head. Sorry.
A question for the governor. Would you like to see the president wear a mask in public spaces?
Well, I think the president his whole team, we were on a call Monday with the vice president. I've spoken with Dr. Burks, Secretary Azar, obviously a lot of other governors. The president wasn't on that call. He's worn a mask on some of the visits. Obviously that's what we're encouraging people to do, and that's why we're going on the statewide tour today.
Do you worry about mixed messages when it comes to masks for some officials? Just being over-politicized?
Well, look, the whole mask issue right now, in my opinion, is being over-politicized, and that's not what we should be doing. But it's not the only issue during pandemic politics that's been overly politicized. But I'll be honest with you, Dr. Toomey and I and our whole team, people like Dr. Arona that's on the front lines in Gwinnett, the people at the testing sites, the folks that are doing contact tracing, we don't have time for politics right now. The message we are sending is the one that I would hope Georgians would adhere to. I haven't been critical of other governors' orders, whether they went too far or didn't go far enough. Everybody's in a tough spot, an unprecedented situation. We're doing the best that we can in our state based on science and data and advice from Dr. Toomey and her team on the ground, and that's what we're going to continue to do.
Governor, after you get your message out, if you don't see it resonating, would you consider mandating a policy to wear a mask in the state?
Well, I'm going to continue to consider every option that I have based on the science and the data. There's a lot of people that don't believe a mask mandate would work. I don't think we're going to have to get to that point. Our citizens have heeded the call before and helped us when we made the call for PPE. They hunkered down and closed businesses, even when they weren't mandated to. We've got a lot of our bigger companies that are continuing to allow their employees to telework and not show up in the office every day. I mean, obviously in some of our bigger cities, that's been an issue for the spread of COVID either on places like mass transit and elevators at high-rise office buildings. And I have great confidence and faith in our people and our business people in this state. You know, look, nobody wants this to continue any longer than it has to. We know it's going to be here for a while. It is a virus. We do not have a vaccine. The work that the White House and the President and their whole team are doing on that at warp speed is pretty amazing, and I'm hopeful that they'll be successful. But that's not going to be here next month or the month after that. So the best thing we can do right now is either don't get yourself in a position where you need a mask, so be outside, be spread out. But if you're in that position, if you're going to go to a 4th of July celebration, or if you're going to go to a backyard party, and we saw where this is some of the spread that happened with, you know, some of our schools would do drive-by graduation ceremonies, which were great, but then there was parties afterwards, and groups of people ended up contracting the coronavirus. So if you're going to be in a situation like that, you need to wear a mask and protect others from yourself, but also protect you. All right, thank you, everyone.
Yeah.